A centerpiece of President Biden's signature legislation, the Inflation Reduction Act, allows Medicare to negotiate lower prescription drug prices for seniors. Drug companies are fighting back in court. We told you Tuesday that Johnson & Johnson filed suit. Drug maker Merck also sued in June, followed by Bristol Myers Squibb a couple of weeks later. All three companies argue the law violates their company's First and Fifth Amendment constitutional rights. Let's bring in Harry Nelson for more. He's the founding and managing partner at Nelson Hardiman. Harry is also author of From Obamacare to Trump Care, Why You Should Care. Harry, what exactly does the Inflation Reduction Act actually say when it comes to this issue of negotiating drug prices?
Yeah, so the Inflation Reduction Act, which passed last August, basically allowed for the first time Medicare to negotiate drug prices starting this coming year with negotiations over up to 10 drugs, with prices taking effect in 2026. And then over the coming years, that will expand to 20 drugs and eventually more drugs. And the point was to go from a system in which Medicare just has to take a certain formula that pays drug companies well to actually allowing Medicare to negotiate.
And the lawyers for these companies say these drug companies say the IRA, the Inflation Reduction Act's provisions, violates their First and Fifth Amendment rights. What's their case? And well, let me just stop there. What's their case?
Well, the drug companies are advancing a whole series of theories. There's a First Amendment claim that being forced to negotiate or face significant penalties is going to amount to an impingement on their right of free speech, that they're being forced, compelled to negotiate, compelled to speak. They're making also an argument that this violates their patent rights and the system that's been negotiated to ensure that they have profits that encourage them to innovate. And finally, they're making arguments that this is a violation of separation of powers and that the administration, the Medicare program, which is part of the executive branch of the government, essentially has too much power as a result of this new law.
And so what's the Biden administration likely to push back against those? Or what are they likely to say to those arguments?
Well, I think the Biden administration is going to say this law passed both houses of Congress. This was not something that was like an executive order or unilateral decision of the administration. This was a law that passed Congress. It had good reason, given that Medicare is spending over, by last count, at least $220 billion per year on Medicare drugs. And that this is a reasonable step, right? The United States is very unusual in the world in refusing to allow drug companies refusing to allow the government to negotiate with drug companies. So the Biden administration, I think, frankly, is going to have the upper hand in these discussions. The drug companies are very, very unhappy about this, and they're advancing creative arguments, but these are not arguments that have ever succeeded in any past case.
Is the Veterans Administration and the way they negotiate drug prices relevant in this instance?
Not at first. At the beginning, for the present time, this law is only going to apply to Medicare Part D, the prescription drug benefit that took place in 2006. And this won't affect the Veterans Administration, at least for the initial years. It's possible, and if this is successful, that this could be easily expanded to apply to veteran drug prices as well.
And Harry, do we have any sense of how this plays out? I mean, for those who are on Medicare and who might be wanting to, see some, or just reducing costs of drug under Medicare now, how this might play out.
Well, I think it's going to be very interesting. We're starting again with a very small list of drugs, mostly some anti-diabetes drugs, some blood thinners, a number, a very, very limited set of drugs that are wildly profitable. My belief is that the pharmaceutical industry is definitely going to continue to make a lot of noise about how this is hurting its profits. We can see that the stock market is responding to that fear. But I suspect that this is eventually going to become part of the system. And frankly, that there's a lot of room for drug companies to still do very well, producing important drugs that are saving lives and improving health. But this is just a difficult thing to get over when you haven't had to negotiate to be forced to, but that eventually this will become a normalized part of our healthcare system and hopefully bring prices down.
Harry Nelson, author of From Obamacare to Trump Care, Why You Should Care. Thank you.
Thanks so much. Thanks for having me on, John.